Colon cancer is one of the most common cancers in the Western world. It kills tens of thousands of people every year, and here is the fact that makes those numbers genuinely frustrating from a medical perspective. It is also one of the most treatable cancers we have, when caught early. The 5-year survival rate for bowel cancer detected at the earliest stage is over 90%. When caught late, that number drops below 10%. The gap between those two outcomes is not about treatment technology, it is about timing, and timing is entirely about recognizing symptoms. Today, I am going to walk you through 9 symptoms of colon cancer that everyone should know, starting with the subtle, easy-to-dismiss early signs, working through the ones that should prompt you to see a doctor promptly, and finishing with one that represents a surgical emergency. I want to be transparent about one thing before we start. Most people experiencing these symptoms will not have cancer. These symptoms are common, and the vast majority have benign explanations. But some people will have cancer. And the people who delay investigation are the ones who lose the window where treatment is most effective. My name is Dr. Victor Hayes. Let us go through each one. Symptom number 1 is a change in bowel habits. And this is the most common early presentation of colon cancer and the one most reliably rationalized away. What matters here is not a one-off variation. Everyone's bowel habits respond to stress, travel, diet changes, and minor illness. What warrants attention is a change that is new and that has stayed changed without a clear explanation. New constipation that has persisted for more than a few weeks. New diarrhea or looser stools that have not resolved. Going significantly more frequently than you used to, feeling like you have not fully emptied your bowel after using the toilet. The mechanism is fairly direct. A tumor growing inside the colon partially obstructs the bowel. Depending on its location, it can speed transit or slow it down, create a sensation of incomplete emptying, or alter the consistency of stool. The pattern shifts because the anatomy has shifted. If your bowel habit has clearly changed and remained changed for more than 3 weeks without an obvious explanation, that deserves medical assessment. It probably is not cancer, but if it is, you want to know early. Symptom number 2 is blood in the stool. And while most people know this is concerning, the clinical nuances matter. Blood can appear in different ways: bright red on toilet paper or in the bowl after passing stool, darker blood mixed into the stool itself, or blood coating the stool surface. The color gives you information about where the bleeding is originating. Brighter red blood tends to come from the lower bowel or rectum. Darker blood often indicates a higher source. It has had longer to partially digest. Hemorrhoids are extremely common and they bleed, often significantly. The natural assumption when someone sees bright red blood on toilet paper is hemorrhoids, and that is statistically the most likely explanation. But hemorrhoids do not always explain rectal bleeding, and new rectal bleeding should always be properly assessed rather than simply attributed to the most common benign cause without investigation. Blood mixed through the stool, rather than just on the surface or paper, is more suggestive of a higher source and is particularly important to investigate. But regardless of the pattern, new rectal bleeding or any change in the character of established bleeding warrants assessment, particularly in anyone over 40 or with a family history of bowel cancer. Symptom number 3 is persistent abdominal discomfort, cramping, bloating, gas, or ongoing lower abdominal pain. Brief variable abdominal discomfort is a normal human experience. The gut is a sensitive organ and responds to all manner of inputs. What distinguishes the pattern I see in colon cancer presentations from the variable discomfort of IBS or functional gut problems is this: the symptoms do not fully remit. They may vary in intensity, but they do not go away. They do not have the clear connection to specific foods or stress cycles that characterizes IBS. They simply persist progressively over weeks. Symptoms that are new, persistent, and progressively worsening, without the variable pattern of typical functional gut issues, should be investigated rather than assumed to have a benign cause. Symptom number 4 is unexplained fatigue. And I understand why this sounds unlikely in the context of cancer symptoms. Fatigue is one of the most common general complaints in medicine, but the mechanism that produces fatigue in colon cancer is specific and worth understanding. A tumor can bleed at a rate that is too slow to produce obvious visible blood in the stool, but fast enough that over weeks and months it depletes your iron stores. Iron deficiency causes anemia, reduced hemoglobin, and reduced oxygen carrying capacity in your blood. The result is a profound, persistent fatigue that does not improve with rest. This is particularly important in right-sided colon cancers. Tumors on the right side of the colon are further from the rectum, so changes in bowel habit may be minimal. Occult bleeding with anemia is frequently the primary or only presentation. If you are persistently exhausted without an obvious explanation, a full blood count and ferritin test are simple investigations that take minutes and reveal a great deal. Do not accept persistent, unexplained fatigue without at least having those checked. Symptom number 5 is iron deficiency anemia without an obvious cause, and I want to be direct about this one. In clinical medicine, iron deficiency anemia without a clear explanation should be treated as possible bowel cancer until proven otherwise. That is not me being dramatic. That is the actual clinical standard, because if your iron is falling without an obvious reason, the most likely explanation is that you are losing blood somewhere in your gastrointestinal tract, and bowel cancer sits at the top of the list of causes. In women who are still menstruating, monthly blood loss provides an obvious alternative explanation. But in men, or in postmenopausal women, there is no normal reason for iron to be disappearing. If it is going down, it is going somewhere, and the bowel needs to be investigated. Anemia from bowel cancer typically presents as persistent fatigue that does not improve, breathlessness with activities that do not normally challenge you, pallor that others notice, and occasionally a racing heart or palpitations. Any combination of these without explanation warrants blood tests, and if those tests show iron deficiency without an obvious cause, proper investigation of the bowel is the appropriate next step. Symptom number 6 is unintentional weight loss. The key word is unintentional, weight loss that you have not attempted to achieve, that is not explained by changes in eating or activity, that is simply happening without a clear reason. Cancer cells are metabolically highly active. They alter the hormonal environment in ways that suppress appetite and disrupt how the body stores energy. People often describe simply not being as interested in food as they used to be, feeling full quickly after eating small amounts, and then gradually losing weight without intending to. As a practical guide, losing more than 3 or 4% of body weight over 3 to 6 months without intentional dietary change is worth investigating. Clothes feeling looser or someone close to you commenting that you look thinner are the kinds of observations that should prompt medical attention rather than dismissal. Symptom number 7 is a sensation called tenesmus, the persistent feeling of needing to go to the toilet even when nothing is there, or the feeling of not having fully emptied despite having just tried. It often comes with a strong urgency to go, and then when you do go, very little or nothing passes. This happens because a tumor, typically in the rectum or lower colon, creates physical pressure that the bowel interprets as a signal to empty, even when it does not need to. Tenesmus is specific enough and unusual enough as a persistent symptom that when it has been ongoing for several weeks, it should be assessed promptly. This is not the kind of symptom that comes and goes with diet changes in a sustained way. If it is new and has persisted for more than a few weeks, see your doctor. Symptom number 8 is consistently narrow or pencil-thin stools over a period of weeks. One episode of narrow stools means essentially nothing at all. Stool shape varies constantly based on diet, hydration, and other factors, but if stools have become consistently and significantly narrower than usual, and this pattern has persisted across weeks, that is a meaningful clinical sign. The reason is straightforward. A tumor growing inside the bowel physically narrows the space available for stool to pass through. The stool takes the shape of the remaining gap. This is a direct physical consequence of something changing inside the bowel lumen. It is not a symptom to wait on once it has been consistent for several weeks. Symptom number 9 is in a completely different category from everything else on this list. This is a surgical emergency. A tumor that has grown large enough to obstruct the bowel, fully or nearly fully, causes severe, progressively worsening abdominal pain. The abdomen becomes visibly distended. Vomiting occurs, which in severe cases may smell of bowel contents. There is a complete inability to pass anything, no stool, no gas. The abdomen becomes rigid and extremely tender to touch. If you or someone around you is experiencing these symptoms, you will know. This is not subtle. This is not a situation for calling a doctor's office the next morning. This is a situation for calling an ambulance or going to an emergency department immediately. A complete bowel obstruction requires urgent surgical intervention. I include this not to frighten anyone, but because people sometimes push through warning signs for months, convincing themselves that things will improve and end up reaching this crisis. Everything I have described today is about preventing this stage from ever occurring. Let me say something important about risk before closing. Age is by far the strongest single risk factor. The vast majority of bowel cancers occur in people over 50, and risk increases meaningfully with each decade after that. Family history roughly doubles your risk. Personal history of inflammatory bowel disease places you at elevated risk and should already involve regular surveillance. Beyond these unchangeable factors, excess weight, particularly abdominal fat, is independently associated with bowel cancer risk. Diet matters significantly. A large study following over 500,000 people found that high fiber intake was associated with meaningful reduction in colorectal cancer risk, while diets high in processed and red meat increased it. These are not vague lifestyle observations. They are directly relevant to whether this cancer develops. The real tragedy of bowel cancer is not how common it is. It is that when caught early, it is in so many cases completely curable, and yet people still die from it because early symptoms were dismissed until they could no longer be dismissed. Most people watching this who recognize any of these symptoms will not have cancer, and that is the most important reason to get checked early, because you will almost certainly come away with a reassuring, straightforward explanation. The people who lose the window are the ones who wait. If any of these symptoms have been present for more than 3 weeks, please speak to your doctor. Early investigation is not an overreaction. It is the most sensible thing you can do. Please share this with someone who needs to hear it, and subscribe to this channel for more content that could genuinely make a difference. I will see you in the next video.